Getting 4 out of 4 medicine offers is completely possible. Getting into your dream university and studying medicine, the course of your dreams, that is all completely possible. But part of being able to do that is making sure you have the really good and strong foundational knowledge to set you up for success in your interviews. In this video, that's exactly what we're going to be going over. We're going to be looking at the idea of the confidentiality, consent, and capacity, or the 3 C's. We're also going to be taking a look at Fraser Guidelines, Gillick Competence, and Refusal of Treatment. These are all really important key principles that you need to have a strong understanding about so you can answer your interview questions with ease and also showcase that you have good knowledge into the medical field. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Let's start off by taking a look at confidentiality. What confidentiality is that any information that a patient tells you that is needed to remain private and should not be told to others unless explicitly needed. And we're going to take a look at in which instances can you break confidentiality. However, in most cases, it's really important that you respect that patient's privacy and maintain their dignity and their wishes. There are some instances where patients may not want their family to know certain things about their condition, or they don't want you to tell other healthcare professionals, maybe because they may feel judged or because they want to keep that doctor-patient relationship. Confidentiality is a really important principle that you should always strive to maintain because it helps you develop that good doctor-patient relationship and ensures that patients are actually able to trust healthcare professionals with all this information. So whether you're a medical student or a doctor, it's important that you are maintaining patient confidentiality. Now, there are some instances where you may need to breach patient confidentiality. Now, if a patient has given you consent to do so, saying that, yes, you can tell my family, yes, you can tell other doctors, healthcare professionals for my care plan, then it is okay to do so. However, if a patient is ever at risk of causing harm to themselves or to others, this may be another instant where you can breach confidentiality. This is because the patient is at risk of causing harm to others or themselves, and you're looking at the greater interest of their safety or for others' safety. Now, when you do go about breaking confidentiality, it's really important that you do it in a manner which is respectful still to the patient. If you do need to break confidentiality, first you should always talk to the patient and try to get them to speak about whatever it is you're breaking confidentiality about first. If not, you need to only tell the people who actually need to know so that you're not breaking confidentiality in a manner which makes the patient really upset or makes them feel like they've lost all trust. Next, we're going to take a look at the idea of consent. What medical consent states is that a person, in this case a patient, is giving their consent, so allowing you to conduct a certain treatment or to do a certain procedure, or they have given their consent to something. Now, it's really important to make sure that you are obtaining consent clearly. So this can be done verbally, where a patient does say yes, or even through examples such as a patient may not necessarily say yes, but if they're taking a blood test, for example, they may put out their arm, which shows to you that yes, that patient is happy for you to take a blood test, as an example. Consent can also be verbal, non-verbal, as long as you have some signal which is telling you that it is okay to continue with that treatment for a patient, that is considered to be consent. It is important that as a healthcare professional, you give patients all of the information that they need to be able to make an informed decision before they give their consent to a particular treatment. treatment. It is not fair for a patient to have to make a decision or consent to a treatment that they don't fully understand, or that as a healthcare professional you haven't given them all the information. Carrying out treatment without getting consent from a patient is considered to be a criminal offence, which is why it's really important as a healthcare professional you make sure that you have given the patient all of the necessary information they can have, so that they can then have an informed decision-making process as to what procedures or what treatments that they want to consent to. Again, this can be implicit, or it can be written, or it can be verbal. As long as you have consent in some form, then you are allowed to continue with that treatment. However, it's also important to highlight a patient can change their mind. A patient may initially consent to a treatment and then halfway through or just before the treatment starts, they may change their mind. Again, it's your job as a healthcare professional to respect that patient's wishes. Now let's take a look at the idea of capacity, or sometimes referred to as competence. Someone is said to have the capacity, so the ability to make a decision, if they follow essentially a certain guideline and they show that they are able to do so. Now, anyone who is above the age of 18 is assumed to have capacity to be able to make decisions, as long as you can show you are able to retain information, remember that information, you can ask questions about it, and you're able to weigh up the pros and cons of different treatments. You are considered to be able to have capacity to make decisions. Now, as I said before, it's always assumed that all patients do have capacity to make decisions, unless for any reason they show that they can't. It's also important to highlight that children, especially if around the age of 16, sometimes you are considered to be competent to make decisions, sometimes not. But we will cover this in more detail in the idea of Gillick Competence, as it can be a little bit more complicated. But as I said before, anyone above the age of 18 is assumed to have the competence to be able to make decisions. Now, it's really important again that you always give the full information to your patients before they make a decision. And if you disagree with that decision, that's okay. As long as the patient has made clear what their wishes are, you do have to respect that. For any patients who do not have competency to make decisions, under the Mental Health Act of 1983, healthcare professionals and police are able to detain patients and actually make sure that they're giving them treatment for different conditions. But this is only ever used if a patient does not have the capacity to make a decision. It's also important to mention that a patient can actually plan ahead for when they may not have capacity to make decisions. There are laws surrounding this as well. But prior to a patient losing capacity or losing the ability to make decisions, they can actually plan ahead for this and say that in the event where a certain thing happens or they develop a certain condition, this is the treatment that they want to receive. Again, this just gives patients more autonomy in their care, deciding how they want different things to go. Now, as I mentioned before, a lot of the principles that we've looked at, especially the idea of giving consent and capacity to make decisions, they apply to those who are 18 years or older. However, it's also important to take into consideration, especially around the age of 16, that's when a lot of children can actually make their own decisions for their healthcare. So this is where the idea of something called Gillick Competence comes into play. Now, what Gillick Competence is, it's basically an assessment that doctors do on children to make sure, are they actually able to make decisions? Do they have the capacity to make decisions about their own healthcare? This is done by looking at the child's intelligence, seeing how much they understand, and the knowledge that they have about whatever condition or whatever is being spoken about in that consultation. So once this has been determined, this means that a child has the right and the ability to make a decision about their healthcare. It's important to highlight, though, that a child may be Gillick competent for some decisions, but not for other. For example, a child may be able to make decisions about one part of their healthcare and say, I want this treatment, and a doctor says, yes, you are competent and you have Gillick competence to make decision here. But for another condition, they may not have Gillick competence, because it depends on the understanding and the complexity of that specific thing that is being spoken about. In the event where the child does not have Gillick competence, this means that it's up to a parent or guardian to make decisions and give consent to treatments for that child. Now let's take a look at Fraser Guidelines. These are similar to Gillick Competence Guidelines, however, these are specific to sexual health advice. Now, for Fraser Guidelines, what the advice states is that as a healthcare professional and as a doctor, if a child cannot be convinced to tell their parents that they are engaging in any sexual activity or to ask them for advice, the doctor would try to encourage them to do so. However, if the patient, in this case a child, does not want to do so, then as a doctor or healthcare professional, it's your responsibility to provide the child with the right information on everything that they need to know about. From this, it's also important to make sure that if there are any concerns or any worries that, for example, the child's partner may be significantly older than them or at the risk of abuse, in those cases you may have to break patient confidentiality because you need to ensure the safety of that child. However, in other instances where safety is the child is not compromised or it's not of any concern, then as your job as a healthcare professional is just to provide that patient the information that they need to engage in sexual activity in a safe way. The final ethical idea I want to talk about is refusal of treatment. Now, as as I mentioned before, anyone who's above the age of 18, they can refuse any treatment as long as they've been given all of the information and they have the capacity to be able to make decisions. Then to respect their autonomy, they can refuse certain decisions. However, things can become a little bit confusing in the 16 to 17 age bracket. Now, English law states that 16 to 17-year-olds are allowed to make decisions for their healthcare as adults are, and they can consent to different treatments. However, it's important to highlight that if a 16 to 17-year-old refuses a treatment, a parent or guardian is able to override that decision. So when you're discussing things in an ethical scenario, if you're ever confused at all, just try to work to the best of your knowledge of what you understand, as your interviewers aren't looking for you to say perfect answers, but to reason with this. So if you are ever given a situation where you have to talk about Fraser Guidelines, Gillick Competence, talk about what you understand about each of these, talk about the ideas of capacity and consent for children specifically, and how you would approach that scenario in the best way possible. It's more about your reasoning process than your answer specifically. I hope this video helped you to gain a much deeper understanding into the ethical principles that are really important in your interviews. Also, don't forget to check out the rest of my channel for more videos looking at the rest of the ethics, NHS hot topics, and the important content to help you achieve your dream of getting into med school.